Hello and welcome everyone to the European Testing Week webinar. Thank you for taking the time to join us today. My name is Lauren Combs and I am the project coordinator for the European Testing Week initiative. The aim of this webinar is to present findings from pilot activities that were organized through the Integrate Joint Action to showcase the steps taken to assess the HIV self-testing situation in both Italy and Lithuania. I'm happy to welcome our two presenters, Dr. Manuel Maffeo from Italy. He is a resident in preventative medicine and public health at the University of Milan. He's also an activist for Arcigay for HIV and sexual health. I'm also happy to welcome Kęstutis Rudaitis from Lithuania, who is an advocacy manager at Asociacija Demetra and a consultant at their checkpoint. Just some housekeeping. After the two presentations, there will be time for questions and answers, so please feel free to enter your questions in the Q&A box on your screen. You are welcome to submit questions for the presenters during and after the presentations. However, please know that any questions will be shared aloud and thus be made public. So please remember to not share any sensitive info. Lastly, this webinar is being recorded and will be posted online. Therefore, if you cannot stay for the entire webinar, you can access the video at a later time. And now, as our first presenter, we welcome Manuel.
Okay, thank you so much for inviting me to this webinar. I'm really happy to show the results for Italy and our pilot in the Integrate project. I will start with a really brief introduction about the Integrate joint action. That is a big European project involving 29 partners from different Europe countries. You can see in the slide in green color. I think that it's really important to stress that partners joining the projects are really have really different backgrounds. There are institutional partners, universities, hospitals, and NGOs, and this really created a good environment to improve and increase integrated early diagnosis and linkage to prevention and care of HIV, viral hepatitis, tuberculosis, and STIs. That is the aim of the project. And inside of the project, one of the work package is related, of course, to self-testing and self-sampling. There are, novel testing strategies, and that can really help to tackle the epidemic, especially in those countries where testing services, public testing services, are not so widespread, and can really help to reach a high-risk population. They are, of course, available for HIV, for some STIs like syphilis, some for HPV and HCV. They are spread this is of course the aim of the work package 5. I'll start with a brief introduction on the European situation about self-test. We can see in this slide how there was a really big increase in its spread during years from 2017 to 2019. We can see how a lot of countries implemented policies. So there is also an interest from public health institution to improve its spread. And of course, we can understand that there is also an industry interest, because of course self-tests are produced by industry that's of course push for the introduction of self-test kit in countries market. So we can, but even if a self-test is available in a country, does not mean that it's available for everyone in the same way, because of course it has a cost, and it's a procedure that cannot be can be not so easy. So the access to self-test is really an issue we have to take care, and there is little interest to produce data about the use of self-test in countries. If we can see we did of course a systematic review of literature, and we can see that there are some aspects that make self-tests really useful, like the possibility of use it of course alone, no need of prescription, and so these are in the slide the reason why people like the test. But of course there are also some problems, like the fear of have results of positivity, of reactivity without any kind of support, lack of experience, the cost. And now, after this brief introduction, I'll explain what we did in Italy for, integrate self-test pilot. In Italy, self-test became available suddenly on 1st December 2016. Suddenly, because no one actually didn't know about it. We on 1st December, we as NGOs involved in HIV discovered that self-test was available in pharmacies. What happened since our national AIDS plan? Say that we need to monitor the use of self-test. We have to understand how many of them are sold, how many diagnoses we make from use of self-test. It says a lot of things, but we have to, be honest. We really have a lack of data about the use and role of self-test in the HIV strategy. We have a lot of questions without an answers, like how many self-tests are sold each year, how many diagnoses are made after a reactive self-test, and so on. And we did our pilot to try to understand some of these issues. We have, of course, some data, like data on availability on pharmacies in Milan, where we understood that it's quite, available, and there are two kind of tests available in Italy in pharmacies with different costs. And from a study in Rome at the National Institute of Infectious Disease, we understood that in this time period, October, September, 10% of the diagnoses, of the newly diagnoses for HIV, were made by using, a self-test. So the main aim of of our pilot was to understand three aspects: the availability of self-tests in pharmacies, uh, the usability of the test. So we made a survey for people using who used a self-test, and we contacted the Mylan helpline. The Mylan self-test is the most spread in Italy. There are other kind of tests, but it's really difficult to find them in pharmacies. Mylan was the first and is still the most spread. So what we did for the availability, we sent our volunteers, both Lila and Arcigay, to visit pharmacies, 167 across Italy, and to pretend to buy a self-test, to understand what happened in the real world. And then the volunteer answered to a questionnaire after the process. These are the number of pharmacies and cities we analyzed. And we discovered that the test is available in like 80, almost 80% of pharmacies. And we considered the test available even if it was not available immediately, but it was possible to order it within a really short time, like one day, at least one day. So where was the test if it was available? For almost 60% it was in the storage. Only in 10% of pharmacies it was visible on the shelf. So we know that in the most cases people have to ask for the self-test for the at the pharmacies, and this can be a barrier. And in the 41 pharmacies it has to be ordered, and only in one we saw it in the automatic machine. And I think that this is really something that should be improved, because it really, improve the accessibility. And this data is actually consistent with another study made by the Minister of Health. As for the price, we see a really bigger range. The price can be from 18 to 32 euros. Most of it are about 20 euros, but as you can see from the slide, it can cost more. We have only in one pharmacy, the pharmacist gave the opportunity to choose between two kind of tests. One, of course, more expensive than the other, but for all other pharmacies, the test available was only one. So we did not collect the data about what kind of tests were sold, but anyway, from a customer's point of view, the price was one, and was that offered by the pharmacist. As for the reasons, the pharmacist told us that 8 pharmacists told us that there was no demand, 5 that they never heard about self-test for HIV, and for 17 pharmacists they say that it was possible to order, but it took more than one day to obtain the test. As for the information gave, we saw that 45 pharmacists did not give any kind of information spontaneously, while 91 gave spontaneous information or after request. As for the quality, we can see that the most part of pharmacists just read the leaflet inside, another information sheet inside the package. Really few pharmacists really gave properly and accurate information about how to use the test. But we also asked our volunteer how was the experience overall, and we had 109 comments, and they were focused on the behavior of the pharmacist. And we can see that 62 gave a positive feedback, while 32 gave a negative one that were mainly focused on the lack of privacy, and this is an important issue for HIV in Italy that's really stigmatized from the population. And so our consideration is that, of course, the self-test is available, it's pretty much available. The costs differ a lot, and cost can be a barrier, and that there were privacy issue and stigma from some pharmacies, and then we have to imagine a different source for information, because obtaining information from pharmacists is really difficult, and it's difficult to imagine to train them, because there are a lot of and are not an homogeneous population. So we have to find other ways. As for usability, we took a small sample of people who never used a self-test before, who were age plus 18 and understand Italian language, and asked them to perform an HIV self-test under our observation, and they failed. A lot of them failed an important step. 10 of them failed an important step. Some of them more than once. The blood collection process was really difficult, and there was difficulty putting the test in the cup. And we asked them. It was easy to use. You can see the range was from really easy from really difficult. They said they wanted some other services together with the self-test, especially contacts with NGO and counseling. So there is a need for counseling using a self-test. And some of them said, of course, that they would like to do an HIV self-test in the future, but without a community health worker, while 13 of them said they would do it, they would prefer to do it alone. Reason why you would use a self-test in the future, of course, the things people most like about self-test are the rapid results, the privacy, the no need for medical prescription. While things people do not like about the self-test, of course, is the lack of counseling, the cost. They are worried about discovering the results alone, and some of them have doubt about the efficacy of the test itself. What are our considerations? Of course, it is a small sample bias. We are not here, to draw, strong conclusion. But what we can say is that although our sample were made by well-educated people and young, 10 of them, 10 out of 28, failed an important step of the process. So maybe the self-test is not so self. What our suggestion? Of course, we would like to improve the informational leaflet, because they noticed how sometimes it's not really clear. We would like to highlight the possibility to see a demonstrational video, because none of them accessed to the demonstrational video that is online, even if we, of course, say to them they could use whatever device they wanted. It's important, I think, to provide another needle in the test, because there is only one needle in the Mylan self-test kit, and if there is a problem with the blood collection process, you can't do. You can try again, and so you have, to throw the test. Or while putting another needle in the package, it's easy and can save money. And of course, it's important to improve contact with NGOs, maybe inserting contacts in the package, and way to call NGOs if needed. The third part of the pilot analyzed the Mylan helpline, because there is a number you can call to ask information, and we performed several scenarios. So we pretended to be people who made the test and asked the information about U equals U, winter period, what to do if the test is positive, and we asked if the test is valid for other STIs. And some general considerations about the quality of the calls is that they were actually really brief, unfortunately. There was a lack of proactive attitude towards untold needs of the users, and there is a lack of link to other resources. The idea is that the customer service, the helpline, is more a customer service really focused on what to do with the test, how to use the test, and not focused on people, the person's needs, and we think that it's important to improve this kind of service because if I'm using a self-test, of course I can have a lot of doubts, and I saw that I see that number in the package, I call the number, maybe I expect to obtain more information and a proactive attitude. In fact, our considerations are to maybe train um, staff from Mylan who ask to this kind of service and to understand how much is it used, because maybe no one call that number during the year, so it's not useful. But if we hope it will be possible to see the data about the number of calls received, because if people calls, I think it's important to receive proper information, and it could be really useful to involve community health workers in that kind of services. And this was, of course, the last part. I really would like to acknowledge, of course, Lila Cosmaro, who is my partner for Lila Milano, and Megan Cole for Public Health England, because these work were made together. Lila and Arcigay volunteers. Without them, none of this would be possible. And of course, Mylan, because Mylan gave us the test for free to use it. And we contacted, of course, the industry to, start a process to improve all the things we talked about, and they answered us. They are really, I can say, happy to collaborate with us. Unfortunately, we had some problem for, of course, the coronavirus outbreak, but they showed their interest to collaborate with us. So, and thank you, of course, for the attention. Now I can think let the word to Kestustis, right?
Yes.
Hello, everyone.
Just a
Can you go
reminder,
next?
if you do have a question, you can enter them in the Q&A box, and then we can answer all questions at the end. But yes, now we move on to Kęstutis from Lithuania.
Thank you, Lorena. So, just small introduction about Demetra. So we are a community-based organization, and our main task is free and anonymously HIV testing for everyone. And the second task is linkage to healthcare. And Demetra also provide harm reduction services for drug users. And Checkpoint is the branch of Demetra, just in the opposite of the main office. And we are open two afternoons per week and thinking about working people. So it's quite new thing about HIV self-test in Lithuania, and we have no any information about that. HIV self-tests cost around 30 euros, 32, 35 in pharmacies, but online you can buy, it ranges from 33 to 29. There is no purchase HIV self-test at the counter, and only orders could be taken. So a person should wait for 1-3 days to receive it at the pharmacy, or maybe to get it from the post office machines. It's quite popular, and which ensures anonymity. There is no formal process to monitor about HIV self-test and about sales data from distributor, and just this collaborating in this project and discussing with distributor, they said that around 500 items are sold annually. And HIV self-sampling is not available in Lithuania at all. So our aim was to assess knowledge and the various and other barriers and needs about HIV self-test. The argument to do this is because clients, especially at Checkpoint, mentioned already about purchased HIV self-test earlier. Clients bring their self-test to show their results or send photo to evaluate results. Even if you have done self-test, individuals wish to repeat HIV test again with specialists, with counselor to make sure about the results. And clients actually ask about self-test to take away to their partners at home because some of them really, if we say that come here, it's anonymous to do HIV test anonymous, no. So this is quite our next steps, I think, with self-test. And our main target group, it was MSM and other sexually active persons and their partners, and who may need HIV self-test. So the survey, or maybe just the research, had three parts. The first was online survey, and the second was paper-based questionnaire, and the third, the direct observation of HIV self-test. A link of online survey was shared on Facebook and MSM specific websites. Some individuals were invited to participate through personal messages. Paper forms were completed by clients after HIV test at checkpoint testing site. And direct observation was done by observing the individual doing HIV test and filling in observation report. Three parts, and the data, more detailed analysis was carried out for the online responses because the sample size was larger. And every question of online survey was analyzed and calculated separately according to response number because someone started the survey, but not everyone ended and answered all questions. So every question was calculated separately. This is the data about online survey, and most respondents were MSN. Actually, we tried to get them because we are thinking about target groups. Most of them had university education or high college education. Age ranged from 15 to 56 years. We asked about HIV test history, doesn't matter rapid or laboratory. So about 78% online respondents had ever tested for HIV, and more than a half did HIV test in the last 12 months. We wanted to see, just asked respondent risk about risk of HIV infections or maybe other symptoms of HIV infections during the last 6 months. 83% reported that they had HIV risk or HIV symptoms, and 62 had more than one HIV risk during the previous 6 months. And other criteria for HIV self-tests were marked less than 6. It was flu-like symptoms, weight loss, unreasonable fever, or other. So this is the main, and the biggest parts are unprotected sex, more than one sex partner, or sex with casual partner. Good news that 73% are aware that HIV tests are available, and 83% trust the test results, but only 37% knew that what to do if they received a reactive HIV self-test. So this is a quite low level about awareness, and this is a target message for us for next steps. Dissemination of information and what to do after HIV positive result. Other questions about awareness, why reasons to choose an HIV self-test, privacy and confidentiality, of course, immediate results, do not require a visit to a healthcare facility. And reason not to choose an HIV self-test. too expensive. As I mentioned, it's more than 30 euros, maybe 25 euros. It's too expensive. The test is not accurate or lack of counseling, and this point is of course for us is for our future work and for our future next plans about how to implement HIV self-testing. Places where to obtain HIV self-test. Chemists and pharmacists, online pharmacy, it's normally, but we were surprised that vending machines, there are no vending machines for HIV self-test in Lithuania, but this could be as an option, and maybe respondents just were thinking about their opportunity to get HIV self-test if there were vending machines. What the probability to do HIV self-test in future? And about 75% said that they are likely to do HIV self-test in the future. And price. More than half of respondents are willing to pay from 5 to 10 euros, and we think it's the best option and could increase popularity of HIV self-test, not only for selling in the pharmacy, but maybe for NGOs as well. And some maybe two respondents just said that it doesn't matter the price. If I really need to know my HIV status, it doesn't mean the price. So even 100 euros, it could be an option. But it was only maybe one or two respondents mentioned about that. Additional aspects, what they would like to have, again, pre-test consultation, post-test consultation, and what are the options and features maybe for self-test? Contact details for HIV support organizations and test for other STIs, and this access to 24 hours counseling and support. So the results. Most respondents in survey reported high risk of risk of behavior, and most of them had more than one HIV behavior episode during 6 months. Privacy and confidentiality, the main reason to choose HIV self-test. Price is the biggest barrier to purchase HIV self-test. And additional features, as I mentioned, in contact details for HIV support, tests maybe for other STIs, and access to 24-hour counseling. And if there was a possibility to get HIV self-test for free, so consultation pre and post consultation would lead to purchase HIV self-test. Some results of other parts of the research, so results of paper form. Paper form respondents are more likely to do HIV self-test in the future, and I think it's normal because they have seen already how to do HIV test during individual consultation. If there was a possibility to get HIV self-test for free, answer is the same. Pre and post consultation will lead to purchase HIV self-test. And more paper form respondents know what to do if they got a reactive HIV self-test results than online respondents. And this is, of course, the respondents filled this questionnaire after HIV self-test, after consultation. So during testing process, during consultation, we talk about what to do, what do you know about HIV, what will you do if you get HIV positive result. And direct observation, we did five direct observations, and this is an example what we have an item of HIV self-test, only one item in Lithuania, only one only one distributor, and it was interesting just to sit and to see how a person do HIV self-test, and what we were surprised that instruction reading is not attentive at all. Sometimes started from the point when finger is bleeding, and sometimes absence at all. The most difficult part was to lance the finger and to form a blood drop. So this is the point of manual and suggestion that we should to add additional lancet for preparing HIV self-test good, and hands were not disinfected before the test, so it's not surprise a bit, but persons could wash hands in before testing, but no one did that. So our suggestion for next step, so to improve information leaflet, and we had a discussion with distributor already, and we prepared a table of revisions, what to improve, what to change, and maybe more pictures, less text, contacts about NGOs, or maybe contacts with infection disease specialists already suggested, and increased availability of HIV self-test for key populations. So maybe funded programs for NGOs, and this is how we want to if we want to reach unreachable target groups, MSM partners, ID users. All this research wasn't implemented or tried with other target groups, for example, drug users or sex workers, and consider availability in vending machines. So this is research and this is survey showed that it could be an option. And improve communications between HIV self-test suppliers, NGOs, health institutions, and we try to implement HIV self-test during this COVID period, because direct rapid HIV testing was stopped. So a need of HIV test, a normal HIV test, free anonymous, remained all quarantine time. HIV self-test were proposed based on person situation, especially psychological condition, a high anxiety, stress, or fear, high risk behavior, and during telephone call, if we talk when we talk with a person, and if a person had a very high fear or stress, so this is HIV test, not depending the result what will be positive, HIV positive or negative. We gave HIV self-test, but during COVID period, there was a barrier that National Lab for HIV Confirmation and Infection Services were not carried out. But we shared about, I think, more than 20 HIV self-tests. Good that all of them they're HIV negative. So consultations by phone or email were done, and pre-test consultations were provided, and we really asked clients some feedback about HIV self-test result, to know results, and we provided some post-test consultation, and some persons sent photos for test for clarifications, and of course leaflets about HIV, about life with HIV, safe sex, or condoms were shared with HIV self-test also. Okay, so thank you.
Great, thank you so much. And so now we will open up for some questions. So one of our first questions, I think it's to you, Kęstutis. They were asking of how many of the responders to your survey were foreign-born.
As I remember, I mean about online survey respondents, yes, and
Yes.
it was about 5 foreigners.
We do have another question. So for communities and countries where self-testing is not available, what first steps would you recommend to take in order to introduce self-testing? Go, Manuel.
Okay, I think it's always important to understand if there's the need to have self-test in the country, what is the possible gap that introducing self-test can cover in that specific situation, because I mean each country has a really different background and different problems to tackle or to tackle first, because it's important to understand that our action is always limited, and we have to choose among things to focus on. I think it's really important to evaluate the impact of introducing self-test in that specific country or in a specific context within a country. As I said, I think it's really useful to involve the industry, because usually self-test is sold in pharmacies or internet, and it can really help I mean to have such powerful stakeholders on your side to help to I mean avoid the legal barriers overcome for the specific context. So that's my answers.
Kęstutis?
I really agree with you, Manuel, Manuel, and this research and this survey showed that additional information in self-test pack or something else, it's very important. So if you want to even just to start implementing HIV self-testing, so think about that. And if you have already HIV self-test in your country, so you can try to do observation study, and you can see the gaps of HIV self-test what you have in your country, and this research and during this research time we saw as organization that we should have some self-test at our testing point, and for persons who will never come or we cannot reach them. So a person who did already HIV self-test can take who did rapid HIV self-test can take one to home to their partner. So this is maybe an option too.
Great, thank you. We have another question. Did you assess if use of video instructions improved usability?
Excuse me, Lauren, can you repeat the question?
So did you assess if use of video instructions improved the usability of the self-tests?
No, we did not do it. We just, acknowledge that our users did not, unfortunately, used a video, even if we told them to perform the test as if they were, at home alone, and do it after buying it in a pharmacy, and we were really clear about the fact they could use whatever they, wanted, whatever help other than our, of course, and even the people who had a lot of difficulties, no one of them thought to see the demonstration video or understood that he or she could see it reading the information inside the package.
And we had practice. We have a link where where a person can see how to do HIV self-test. So if a person write an email about asking about HIV test, about HIV self-test, so we can reply them and with direct link where to see how to do HIV self-test. So that was a good collaboration with distributor, and they showed us a link, and we shared the link for others.
We do have a comment regarding the particular Mylan self-tests where they were reported popular amongst a certain population, and so they wanted to know if there's been other experiences with these tests, at least Manuel, if there's been any issues.
In the and no, in our, of course, pilot, people using the test were possible users. So it's they had their problems, but it's not possible to make such conclusions from that study. But I agree with you that from my experience as a community member, self-tests have a lot of problem, because of course the use of the test is not so easy sometimes, and there are other options. Of course, I think the coronavirus outbreak and lockdown gave another. We have to analyze the self-test under another light, because I think the lockdown improved the possibility to use the self-test and its role. But we have, I think it's important that we have to understand what is the role of self-test in the testing strategy, because it is a weapon, but we have to understand how to use it. Because if people using the self-test are just the same people that usually go to the other testing services, and they prefer it, it's okay, but I think we are not reaching, specific population and population we need to reach. While if there is really a spot and a place for this kind of instrument to reach really hard to reach population, then it's okay. It's okay to promote it and invest on it, especially as a community organization, as NGOs. But I really think we need more data to understand if self-test is something to invest on, or working on other things is more important and can have a deeper impact.
And so we have another question for both of you. Do you know of any current or future plans to do similar pilots in your country, or maybe Kęstutis, in your case, to expand on your HIV self-testing services because of the pandemic?
We hope pandemic will end and we started HIV testing, but I think that I think that it would be interesting to do similar research and among other target groups. For example, drug users, because they come to our harm reduction services, but they live in close communities, and not everyone from their communities come to our place. So if someone regularly do HIV test at our Demetra site, so maybe he could take HIV self-test for friends. We don't know a lot of situation or just a situation about sex workers and our work hours, and we are open only until 4 or 5. So how to reach these target groups? So I think it could be a good opportunity to repeat.
And Manuel?
As for, as for other, next steps, and I we presented this data in the minister at the Minister of Health, and they were happy to understand this kind of data, and to discuss next steps. But I have to admit did not see this a big effort to really understand what is the role of the self-test in Italy, if if there is one to tackle the epidemic. But as I said before, I don't want to repeat myself. I think it's really important to understand if self-test is just another option to take the test, and it would be, of course, okay, because everyone has the right to decide how to test him or herself, or if the self-test can be really useful for specific population, or migrants, MSM who have difficulties to access to checkpoints or other testing services. I think we need evidence and data to understand this.
Great. Thank you. So if there are no other questions, you can also, if you have further questions or at a later time, you can always email the European Testing Week Secretariat, and then we can forward the questions to Manuel and Kęstutis. But otherwise, thank you to our presenters, and thank you to everyone who joined our webinar today. You will get an email possibly tomorrow regarding an evaluation, which helps us to plan for future webinars. Thank you again to everyone, and we'll see you next time.
Thank you everyone. Thank you for the invitation.